Thank you very much. As you have been introduced, I'm talking to you from Johannesburg in South Africa. If you don't know where that is, look at the map of Africa and go down to the last tip of the map. That's where South Africa is. It's a country of about 559 million people. So it is a very, very, very big country. I mean, if you compare it to my previous speaker, the doc, Cambodia, then yeah, it's quite a big country. We have about 25,000 public schools. That's what you call government schools. They're around 25,000. Then you'll have very few independent schools that are in there. But what I thought I should talk to you about today, if you move into the next slide, it is the fact that we wanted to share with you what we went through. I think we had our worst situation around COVID-19 last year. From March until July, we were hardest hit. We then got a second wave around December. We're now beginning to see an increase once more. But as a country, we then thought, if we suspend our life, what's going to happen? Shouldn't we rather learn to live with this virus and try and adapt our lifestyles to the needs of this virus? So I thought, let me talk to you about why we must live with it, what we must do to live with it. Then I'll give you the concluding remarks. What you're seeing on the screen there, it's what we think we're considering as a country, that paramount to everything is the saving of lives. That remains the biggest thing that we do. But as we save lives, it is important also to save livelihood. So it's a balance between saving lives, that we might die of the coronavirus. But if we don't die of the coronavirus, we'll then starve to death. So you need a balance between the two, lives and livelihood. Then we then look at different risks assessments that assist us to mitigate between the two. Then we'll then close schools and open them as and when there's an increase in the infections, we'll close them. Then we came up with a timetable of some sort where we allowed learners to come to school on a rotational basis. Some learners will come on a Monday, the others will come on a Tuesday, and they'll alternate like that. In some schools where it's possible, learners will come once a week and others will come the following week. Where possible, some learners will come in the morning, others will come in the afternoon. So that depends on the size of the school and the facilities and resources that they have. And we were trying to make sure that every child gets an opportunity then to be able to go to school and have some learning that takes place. So we managed to do that from last year. We're still continuing to do that, where we are alternating these learners as they come to school. Now, the challenges are the following. This is what we've discovered as a country, why we must live with the virus, is that we have learned as a country that there is inconclusive evidence around the infection risks related to school attendance. We're not seeing a lot of infections coming from the schools themselves. It is actually the communities that brings these things into school. How we have learned about that, when we closed schools around December, the infection rates were very low. But a week after closure in December, then we got an escalation of infections right through the country. And our conclusion was that it looks like our children are safer when they are at school than when they are at home. When they are at home, they play freely, they do not social distance, they do not wear face masks, they do not sanitize. It becomes a free for all. But at school, it looks like that's where there's more order, more organization, and where there is adherence of these principles. So to us, school is the safest place for children than when they are at home. We have also realized that there has not been incident of children under 12 recorded that have been infected by the coronavirus in our country, which basically means these children at primary school are at lower risk. There is these global school closures in response to coronavirus or a pandemic, which then, I'm quoting here the United Nations Secretary General, that global school closures in response to the pandemic presents an unprecedented risk to children's education, protection, and well-being, which means the extended interruption of one's studies causes not only the suspension of learning time, but causes a loss of knowledge and skills that were gained. And this, you will see over time that our children are falling behind in language acquisition, in reading and so on. The more we keep them away from school, the more they are losing the skills that they got. Then interrupting education services also have long-term consequences for economies and societies, and such as increased inequalities, the poor becomes more poor, and then we have a reduced social cohesion. It just makes us unfriendly. Children need to learn to be together and be able to socialize. There are things that are only received at school. In South Africa, we feed about 80% of the children. They have meals at school. When you close schools, it means children starve at home. There are services like immunization from the Department of Health that takes place at school level. Children receive psychosocial support from school. So the moment you close schools, all those services then suffer, and it compromises the support that you're supposed to give. People have been preaching that let's use technology, but all over the world, there is generally lack of technological infrastructure, and remote learning approaches cannot be sustained. It's only a few that are able to access such technologies. There are also differences among learners receiving support from parents. Not all parents can provide that support adequately in their private of their homes. There are differences in the capacity of different types of schools. Some schools can, some schools cannot. So in simpler terms, it means the best place for a child to grow and learn it is at school. You cannot replace that face-to-face engagement with a teacher with technology or any other thing. And if you keep them away from school, you are actually destroying their future. We'll be able to see this in 10 years, 12 years time, when they have to get their senior certificate or matric or whatever you call it in the country, that there will be a gap between these children and those that preceded them. We can move into the next one. So how can we survive? We want children back at school. So in South Africa now, the discussion is, can we bring back all primary school children to school and not allow them to alternate like I've indicated before? Let them have a full day, all of them, because we have realized they are least affected by the virus. And in fact, we're saving them from all the social ills when they're at home. They are exposed to all the social ills that you can think of: rape, abuse, starvation, and all those things. Then the only place they can be is to protect them. But if we do take them to schools, we need to ensure that we reduce the transmission in schools. That is, we'll have to ensure, put these rules clear for everybody, that they need to adhere to non-pharmaceutical interventions. That is, optimizing the spaces between learners and among teachers. Just reduce that contact. When they are at school, The wearing of mask is mandatory, making sure that it covers the mouth and the nose at all times. We want to limit the potential exposure. That is, we strict on screening. And what we do, we hire young people, unemployed young people, to do this job for us. We limit the number of visitors at school, we limit movement of learners, and we insist that the learners who are sick always stay at home. Social distancing is mandatory. We can also introduce a lot of other things like using partitions and keeping the children more outdoor as we teach them so that there is natural ventilation, and try and vaccinate teachers as quick as possible, just to make sure that we learn to live with the virus and we don't suspend our life. Because if we do, the next slide says, if we stop living now because of the virus, by the time we defeat this virus, we would have forgotten how to live ourselves. So it is important that we learn to live with it now. And that's my input, ladies and gentlemen. Thank you very much.